Chronic diarrhea, can it cause hemorrhoids or piles? That's the topic today we are going to see. We all know hemorrhoids or piles is nothing but painless bleeding, where the blood vessels in the anal area as well engorge. So that is called piles. But in the previous videos also we've been talking about constipation is the main reason. But diarrhea, though it's not well known, but is one of the main reason, or maybe it's maybe the absolute reason apart from the constipation can cause hemorrhoids or piles. How? So generally hemorrhoids is nothing but engorged blood vessels where when you strain there will be drops of blood. That's called painless bleeding in drops. So in diarrhea what happens? Normally the digestion process, we have food, water, acid, and you have bile, you have enzymes, you have intestinal pancreatic juice, all these travel, go down, and as they go down, all these enzymes, oil, bile, acid, everything is reabsorbed in the colon, and the motion becomes solidified, or it becomes thick. The fluid is absorbed and it becomes solidified. But in diarrhea, what happens? This solidification is not happening. That means these acid, bile, the enzymes, the pancreatic juice, they are not reabsorbed. So they all go out and they come and touch the anal region. They can irritate. So they can irritate the mucosa, blood vessels, and this causing hemorrhoids. The second and very important thing is the force with which the diarrhea happens. So the pressure on that anal area causes again the hemorrhoids. The third is cleaning. So once for every time when we move our bowel in diarrhea, we have to clean it. So if it is Western type, like you clean it with wipes, then again it directly induces the mucosa leading to piles. Or even in Indian culture, we use water. Repeated wash can damage the mucosa, the anal region, the blood vessels will be affected, and it can present as a hemorrhoids. So people with diarrhea, chronic diarrhea. So this diarrhea can be sometimes temporary, or people with chronic pancreatitis, they'll have a frequent diarrhea, fatty, or even with ulcerative colitis people, they all have a chronic diarrhea where these changes or these blood and other things can irritate that mucosa causing hemorrhoid. What they say is either they may see bleeding per rectum, or there is a mass, a bulge that comes and goes initially. That's what they say. So if you have a diarrhea and you see a bulge or pain or bleeding, something prolapsing out, consult your doctor. He may examine you. Probably if it's piles or hemorrhoids, probably do the proper treatment. Thank you.